My today's topic is antipsychotic drug, which is in subject medicinal chemistry in unit 4 and subject code is BP 402 in B form 4th SEM. History. In 1891, Paul Ehrlich observed the anti-malarial effect of methylene blue, a phenothiazine derivative. Later, the phenothiazine were developed for their antihistaminergic properties. Hemon and Dele extended the use of this treatment in psychiatric patients and uncovered its antipsychotic activities. Between 1954 and 1975, about 15 antipsychotic drugs were introduced in US and about 40 throughout the world. In introduction, so antipsychotics are also known as a neuroleptic or major tranquilizers, are a class of medications primarily used to manage psychosis, principally in schizophrenia, a bipolar disorder. First generation antipsychotics known as typical antipsychotic were discovered in 1950 as we earlier discussed in history. Second generation drug known as atypical antipsychotics. First atypical antipsychotic was discovered in 1960s and introduced clinically in 1970s. Definition of antipsychotic. An antipsychotic drug are a class of medicines which is generally used to treat psychosis and other mental and emotional conditions of any of the patients. Classification of antipsychotic drug. Here, chemical classification. In phenothiazine, we have aliphatic side chain. In aliphatic side chain, we have an example of chromoprozine and trifluoprozine. Piperidine side chain, thiazide, and piperazine side chain, fluorphenazine is an example of phenothiazine and their classes. Butyrpherones, that is example is haloperidol, trifluoperidol, and panfluidol. Thioextine is example is fluothiazole. Other heterocycles are pimizide and lopoxin. A typical antipsychotics examples are clozapine, risperidone, olazapine, quetiapine, aripiprazole, and zapiprazidone are some of the examples and their classification of chemical. Indications. Antipsychotics are mainly used in the treatment of acute and chronic psychosis, particularly when accompanied by increased psychomotor activities. That is, these activities are organic psychiatric disorders just like delirium, dementia, delirium tremens, etc. Second is functional disorder. This is schizophrenia, schizoaffective disorders, etc. Next is mood disorders, that is a mania, major depression with psychotic symptoms are the main indication of antipsychotics and psychosis. Childhood disorders, that is attention deficit hyperactivity disorder, that is autism. Next is neurotic and other psychiatric disorders such as anorexia nervosa, intractable OCDs, dyslabing anxiety, and next is medical disorder. In medical disorder it is Huntington's, chorea, nausea, vomiting, eclampsia, and heat stroke are the major examples of such medical disorders in psychosis. Pharmacokinetic. Antipsychotics when administered orally are absorbed by gastrointestinal tract with uneven blood levels. We can understand here that these antipsychotic drugs were given orally to the patient and it may generally absorb through GIT tract with uneven blood level. They highly bound to plasma as well as tissue proteins. They are metabolized in the liver and excreted mainly through the kidneys. The elimination or half-life varies from 10 to 24 hours. We can say that the half-life of the antipsychotic drugs are generally 10 to 24 hours in our body. Mechanism of action. Antipsychotic drug blocks D2 receptors in the mesolimbic and mesofrontal systems. Sedation is caused by alpha adrenergic blockade or antidopaminergic actions on basal ganglia are responsible for causing EPS, that is extrapyramidal symptoms. These atypical antipsychotic have an anti-serotonergic and anti-adrenergic and antihistaminic actions are also found. Contradictions. Hypersensitivity, that is cross sensitivity, may exist among the phenothiazines, not to be used when CNS depression is evident, when blood diseases exist in patient with Parkinson's disease, that is in liver, renal or cardiac insufficiency, elderly, severely ill or respiratory insufficiency, prostatic hypertrophy or intestinal obstructions are some of the major contradictions of these drugs, which is generally used in antipsychotics. Side effect and nursing implications. First is anticholinergic effect, that is dry mouth, in which provide sugarless candy, ice and frequent lips of the water. Strict oral hygiene, blurred vision subside with few minutes, don't drive, clear smells, item for pathways. Constipation, increased fluid intake, higher fiber diets, increased physical activity, urine retention, monitor intake and output, report to if difficulty while urinating, nausea, gastrointestinal tract, administered fruit juice and concentrate must be diluted with the oral liquids. Skin rashes, report appearance of any skin rashes, avoid spilling of liquid concentrate on skin. So here in contradictions and the side effect of nursing implications, we can say that these are the certain symptoms through which we can avoid this type of symptoms that appeared through the antipsychotic drug, that is dry mouth, blurred vision, constipation, urinary retention, nausea, vomiting, in GIT tract, skin rashes and sedation. In sedation, administered drug at bedtime, don't drive or work while drowsy or after using sedatives, low doses, orthostatic hypertension. Rise slowly from a lying or sitting position, monitoring BP documents and report if any of the changes. Photosensitivity, wear protective sunscreen, clothing and sunglasses while spending times outdoors. Weight gain alternate days, calorie controlled diet, provide exercise instructions. In here antipsychotics, they show some actions like the antipsychotic actions are due to the blockade at dopamine or serotonin receptors. Many of these agents also block cholinergic and adrenergic and histaminergic receptors, causing their adverse effect. They shows antipsychotic actions, extrapyramidal effects, antiemetics effect, anticholinergic effect, and they also show some other effects also. Here is the classification. As we know earlier in history, there are so many generations of drug which has been discovered and monitored various in various years. So first of all is pharmacological classification. Here first generation drugs are low potency drugs. Example are chlorpromazine, chloroperazine and thiodizine. These are low potency drugs of first generation. Second is first generation antipsychotic with high potency. Haloperidol, pemoxizide, thioxazine are certain drug of first generation drug with having high potency. As that we have second generation drug, that is asparagine, which convert to olazepine, aspirin, azepine that converted into quetiapine, clonazepine, paliperidol are some of the examples of second generation of antipsychotics. Here is the chemical classification. phenothiazine aliphatic side chain, piperidine side chain, piperazine side chain, butylphenones, that is haloperidol, trifluridol, penfluridol are certain of the examples, and other heterocycles, pimozide, loxapine, and atypical antipsychotics. Pharmacotherapy of mental illness. Here, first generation antipsychotics. The first generation antipsychotic drugs are competitive inhibitors at variety of receptors. They are also called conventional, typical or traditional antipsychotics, which may be generally used in first generation. But their antipsychotic effect reflect competitive blocking of D2, that is dopamine receptors. First generation antipsychotic are more likely to be associated with movement disorder, particularly for drugs that bind tightly to the dopaminergic neuroreceptors such as haloperidol. Haloperidol are the drug which may generally bind the dopaminergic neuroreceptor, which is generally associated with movement disorders. Pharmacotherapy of mental illness of second generation antipsychotic drugs. The second generation antipsychotic drugs are also referred to as antipsychotic. Here we can know that second generation drugs are also called as atypical, and first generation drugs are called as typical antipsychotic drugs. Have fewer extrapyramidal symptoms, that is EPS, than the first generation agents, but are associated with high risk and metabolic side effect such as diabetes, weight gain, hypercholesteremia, etc. The second generation drug appear to owe their unique activity to blockade of both serotonin and dopamine receptors. Patient family education. This is the main point of antipsychotic drug, because patients' education is very important while giving to these antipsychotic drug. So here first point is be cautious while driving and operating dangerous machinery. Don't stop medication after long time use. Use sunscreens and wear protective clothing while spending time outside. Report occurrence of symptoms like sore throat, severe headache, rapid heart rate, difficulty in urinating, twitching, tremors, darkly colored urine, yellow skins or eyes, skin rashes or seizures. Rise slowly from sitting position to prevent sudden drop in BP. Take frequent sips of water, chewing sugarless gums. Maintain oral hygiene. Consult physician regarding smoking while on neuroleptic therapy. Dress warmly in cold weather and avoid extended exposure to very high or low temperature. Body temperature is harder to maintain with this medication. So thank you everyone. Here is my some views on antipsychotic drugs. Thank you everyone.